Welcome to the Advanced Old Health and Life Coach certification. Today we're going to be looking at illness-specific health coaching certifications, more specifically about the health coaching for hypertension. Introduction. Hypertension is most commonly referred to as high blood pressure. It's a chronic medical condition characterized by persistent elevation of the blood pressure levels. It's often called the silent killer because it rarely exhibits obvious symptoms, which significantly increases the risk of heart disease, stroke, kidney damage, and other complications. According to global statistics, hypertension affects over 1 billion individuals worldwide and is a leading cause of preventable deaths. Key points. Understanding hypertension. What is it? It occurs when the force of the blood against the arterial walls is consistently too high. Blood pressure is recorded as two numbers, systolic and diastolic. A normal blood pressure reading is typically around 120 by 80 mmHg, and hypertension is characterized as follows. Stage 1 is between 130 to 139 out of 80 to 89 mmHg. Stage 2, more than 140 by more than 190 mmHg, and hypertensive crisis is more than 180 by 120 and requires immediate medical attention. The pathophysiology of hypertension. Hypertension develops due to a complex interplay of genetic, environmental, and lifestyle factors that affect the cardiovascular and renal systems. Here's a deeper look. Vascular resistance. Chronic hypertension occurs when the blood vessels are constricted or less elastic, forcing the heart to pump harder. Renin-angiotensin-aldosterone system. Dysregulation of this system increases the blood pressure by promoting sodium retention, blood volume expansion, and vasoconstriction. Autonomic nervous system. Overactivation of the sympathetic nervous system can lead to higher heart rates and vasoconstriction. Endothelial dysfunction. The endothelium plays a role in regulating vascular tone. Damage or inflammation of this lining can impair its function and elevate the blood pressure. Over time, these changes contribute to complications like left ventricular hypertrophy, atherosclerosis, and organ damage. Health impacts of hypertension. Unmanaged hypertension can significantly increase the risk of conditions such as cardiovascular diseases like heart attacks and strokes, chronic kidney disease due to high pressure injury to renal blood vessels, vision loss from hypertensive retinopathy, and development of aneurysms in arteries. The role of lifestyle changes in blood pressure management. Hypertension is highly responsive to lifestyle interventions, and in many cases, blood pressure can be controlled or significantly improved through the non-pharmac means. Below is a breakdown of the most impactful strategies health coaches can use with their clients. Dietary modifications. Diet plays a central role in blood pressure management. Health coaches can guide their clients in implementing the following evidence-based dietary recommendations. DASH diet. This emphasizes fruits, vegetables, whole grains, lean protein, and low-fat dairy while limiting the saturated fats, sugar, and sodium. Studies show that it can lower systolic blood pressure by 8 to 14 mmHg. Sodium reduction. The American Heart Association recommends limit sodium intake to 1,500 to 2,300 mg per day. High sodium levels increase the blood volume and pressure through the water retention, encourage clients to avoid processed foods and to use herbs and spices instead of salt for seasoning. Potassium for blood pressure buffers. Foods which are rich in potassium counteract the sodium effect on the blood pressure, so encourage the clients to include bananas, potatoes, beans, and spinach in their meals. Weight management through caloric awareness. Excess weight strains affects the heart and contributes to the high blood pressure. Coaches may help create a meal plan aligned with calorie deficits when the weight loss is essential. Stress reduction techniques. Stress triggers the release of hormones like cortisol and adrenaline, which temporarily raises the blood pressure and can result in long-term damage. Key stress reduction strategies include mind-body practices. Teach the client some techniques like mindful meditation, yoga, and tai chi. Studies show that these activities can lower the systolic blood pressure up to 5 mmHg. Breathing techniques. Encourage spaced breathing or diaphragmatic breathing that activates the parasympathetic nervous system and reduces the blood pressure. Sleep hygiene. Poor sleep has been associated with hypertension. Educate the clients on the importance of consistent sleep schedules, reducing screen time before bed, and creating relaxing bedtime routines. Physical activity. Engaging in regular physical activity strengthens the heart and reduces blood pressure. Recommendations include aerobic exercises like walking, swimming, or cycling, resistance training to help improve the blood vessel elasticity, daily movement like taking the stairs, walking the dogs, or gardening, and smoking and alcohol. It contributes by causing excess hypertension contributors, and coaches should encourage tobacco cessations as providing options like nicotine replacement therapies or mindfulness strategies to curb the smoking habits. Moderation in drinking. Focus on staying within the recommended limits of one daily drink for a woman and two for men. Highlight the connection between alcohol and increased artery stiffness. Coaching strategies for behavior change. A. Building trust and understanding. Start by empathizing with the clients. As individuals with hypertension may feel overwhelmed by the perceived complexity of lifestyle changes. Use MI or motivational interviewing to uncover the readiness or change and collaborate on realistic goals. You can also do some goal setting with some SMART principles, helping the client set goals that are more specific, measurable, achievement, relevant, and time bound, of course. Example, you can also do some reducing sodium intake to under 2300 mg by gradually eliminating processed meats within the next 4 weeks. You can also do by tracking process, such as using blood pressure logs, food diaries, and activity trackers to provide the clients with objective feedback. Celebrate milestones, no matter how small, to foster ongoing motivation. Customize solutions. Every client is different. Some may struggle with dietary changes, while others may find stress management challenging. Tailor the interventions to individual preferences, health goals, and cultural backgrounds. Example, recommend culturally appropriate DASH diets alternatives for dietary culinary traditions. Fostering long-term commitment. Lifestyle changes for hypertension requires consistency and sustainability. Use education to reinforce how each behavior contributes to long-term health outcomes. You can teach the clients how to adapt their habits during vacations, social events, or periods of stress, ensuring maintenance over time. Advanced insights and lesser-known tips. Gut health connection. Emerging research indicates that gut microbiome may influence hypertension. So, encourage your clients to consume high-fiber foods like oats, legumes, and fermented products such as yogurt or kefir to promote gut health. Magnesium and hypertension. Mg supplementations promise by reducing the blood pressure. Foods like almonds, avocados, and spinach are excellent sources. Biofeedback techniques. Biofeedback devices can help the clients visualize and control physiological responses like heart rate and stress levels, improving the blood regulation. Best practices for coaches. Managing hypertension through life and health coaching requires a sophisticated approach that balances education, behavior modification, and emotional support. Here are the best practices you can follow. Build strong rapport and trust. Trust is the foundation of coaching, and clients must feel comfortable discussing their habits, challenges, and emotions. You can implement by using active listening, showing empathy, and demonstrating non-judgmental support. 2. Educating on client hypertension and lifestyle impacts. Why it matters. Clients often lack a full understanding of how the lifestyle factors influence blood pressure. You can include by providing actionable insights and key areas such as effects of sodium, potassium, and exercise on cardiovascular health. Share simplified explanations like comparing blood vessels to elastic tubes that weaken under constant pressure. You can also use visual aids such as food pyramids or blood pressure charts to make the learning process more engaging. Set realistic and achievable goals. Overly ambitious goals can demotivate the clients, whereas attainable ones foster confidence. You can implement by encouraging SMART goals, example including one potential-rich food daily for the next 2 weeks. Tailor your approach to each client. You can do this by using unique preferences, challenge, and cultural context that affects their choices. Implement by customizing dietary suggestions or exercise plans to their needs. For example, recommending DASH-friendly recipes for the cultural cuisine. Foster consistent tracking and accountability. Monitoring progress can help the client see the impact of their efforts and stay motivated. You can implement by encouraging tracking through tools like blood pressure diaries, food logs, or fitness apps. 6. Promoting stress management techniques. Stress is a critical trigger for hypertension and often underestimated. Teach techniques such as guided breathing and some gratitude journaling. 7. Address psychological barriers. They often cause a lot of roadblocks to hinder the behavioral change. Example, you can use motivational interviewing to elicit and resolve ambivalence. Ask open-ended questions like, what do you think would be the easiest change for you to make your blood pressure lower? 8. Incorporate evidence-based dietary guidance. Key focus area, reduce sodium retention. Recommend swapping salt with herbs and spices. Potassium-rich foods. Showcase the benefits of bananas and sweet potatoes. And DASH diet principles for overall nutrition. 9. Facilitate physical activity plans. As regular exercise lowers blood pressure, it is really important for the clients to start with this. You can begin with accessible activities tailored to fitness levels, such as just 10-minute daily walks. Reinforce the importance of rest. Rest and sleep quality significantly affects your blood pressure. You can establish sleep hygienic practices such as consistent bedtimes and reducing screen times before sleep. Navigating fluctuating motivation and setbacks. Consistency is a challenge for many clients, hence reframing the setbacks as learning opportunities would allow the client to be more consistent. Example, if a client skips a workout, explore what disrupted the routine and brainstorm the solutions together. 12. Create a safety net of social support. Social support keeps the clients accountable and motivated. Example, you can encourage the clients to involve family or participate in community activities like cooking classes or fitness groups. Stay updated on emerging research. Advanced insights, you can discuss some gut health and its connection to hypertension. Offer practical advices in incorporating high fiber and fermented foods in the diet. 14. Is fostering long-term commitment. As you highlight the immediate benefits of the lifestyle changes, it will help to maintain momentum while reinforcing long-term benefits like reduced heart disease risk. You can also talk about wins like an improved BP reading or the clients feeling much more calmer. Practice self-evaluation and growth. Coaches must continuously refine their skills and stay informed. Attend workshops, engage in peer discussions, and seek client feedbacks for deeper insight and stronger results. Let's have a look at the summary tables. Table 1 looks at the dietary modifications for hypertension management. Let's have a look at some strategies. One would be sodium retention. Limit the sodium intake to 1500 to 2300 mg per day. Example, avoiding processed meats and canned soups. Impact on blood pressure, it reduces the water retention and BP. Coaching tip is to suggesting using herbs and spices instead of salt. Take a moment to have a look at the rest of the table. Table number 2 looks at the stress reduction techniques for hypertension. Let's have a look at sleep hygiene as one of the tricks. Description: practices that improve quality and consistency of sleep. Example is avoiding screens before bed and consistent bedtime. Impact on blood pressure: stabilizes BP by reducing cortisol activity, and a coaching tip is to create personalized sleep routines. Table number 3 looks at the physical activity recommendations. Let's have a look at resistance training as a type of exercise. Description is that these exercises improve muscle strength and vascular health. Example, weightlifting, bodyweight exercises. Frequency or duration would be 2 to 3 days a week, non-consecutive, and its impact is that it enhances the metabolic health. Table number 4 looks at coaching strategies for behavior change. Let's look at tracking progress as one of the strategies. The purpose is to provide measurable feedback to the clients, example, logging BP readings, food or sleep tracking. Implementation is using apps or journals to make the tracking easier. Benefits is that it celebrates milestones and builds motivation with time. Table number 5 looks at the advanced insights and additional considerations. Let's look at gut health and BP as one of the insights. Description is that gut microbiota is linked to inflammation, which is affecting the BP regulation. Example, including yogurt, fiber-rich foods. Application in coaching is suggesting fermented foods and probiotics, and client benefits is that it supports the BP and overall immunity. Let's have a look at some MCQs. Take a moment to answer question number 1 and 2 without looking at a correct answer. Number 3 and 4. And finally question number 5. Thank you.